Yeah, our next surgeon is Dr. Savio. He is a senior consultant, phaco-refractive, an excellent surgeon, phaco trainer, and
Yeah. Yeah.
over to Dr. Savio now.
Thank you very much, sir, for the wonderful opportunity. AIOS for a great platform. Dr. Namrata Sharma and Rajesh Sinha, really great work you are doing, and J&J giving us this opportunity. So the case I'm doing today is a 71-year-old female. She is a hyperope plus 26 diopter lens which I'll be implanting. The lens which I'll be implanting is Synergy, 21.43 axial length. So in hyperopes, it's always tricky, especially even for refractive surgeries. So if you can give them a lens like the Synergy, which gives them a continuous range of vision, it's really great.
So let's start the case, Savio.
Yes, yes.
Looking forward to your case. Like I said, today we have a huge viewership on YouTube and
Yes.
Facebook. I think it is all to do with Netradhama and excellent team of surgeons.
Yes. Aji light ಕಾಣಿಸ್ತಾ ಇದೆಯಾ?
So, Savio, you are on 3D as well. I see that
Yeah, I'm using the microscope. The 3D is also on, but I'm using the microscope.
okay.
Yeah, I prefer the bimanual irrigation aspiration, and that's the reason why I'm making my two side ports. And I also do my rexes from the side port. So here I'm doing my intracameral lignocaine for the anesthesia, putting a little bit of viscoelastic. Kanali ಸ್ವಲ್ಪ pressure ಆಗುತ್ತೆ straight ನೋಡಿ. Being a hyperope, there's a slightly shallow AC.
So I think it's a great variety of cases. We've seen a myope and now it's going to be a hyperope.
True, true.
And different demonstration of the techniques, like you do from the side port. We saw 3 rexes which were being done from the main port. I also use 2 side ports just like you do, and I was wondering, maybe because of the speed, Sri Ganesh uses only one.
No, the advantage I would say is the chamber remains a bit more
Yeah.
stable,
Yeah,
and
and of course if you are using a bimanual irrigation aspiration, then that
yes.
is good.
I hope the visibility is good.
Yeah, it is perfect. Like I said, every single vessel, the transmission is very nice.
So I've gone for the 5 mm rexes so that you can see the posterior wave. Light, Nadiaji. Yeah. So there we got the hydro done, the rotation also is done. So I'll be using the continuous white star mode again.
So there is this question, Savio, that Sheetal talked about variable white star mode and you're talking
Yes.
about continuous. So what is the difference between the two?
So basically when you have your white star mode, it's nothing but hyper pulses which are there. And here you can see, yeah, I'm just going to go very deep. You got the good occlusion sound which is there and there. Just separate into 2 pieces. Now once this is done, again vary it, and there you got again. Now this was a partial chop, so I'm just going again to separate it there. Now yeah, so here you can see we have made 4 pieces, and pick up the piece, remain in the safe zone. Now I've kept the ramp as 60, so it's quite fast actually. If you see the way it eats the pieces, it's very fast. Requires a little bit of finer foot pedal control. Sometimes you'll have these small pieces which will be attached at the back. You can always go ahead and flip the nucleus. And here you see we've eaten half quadrant. We can just go ahead. Heminucleus is done. You have a little bit of the epinucleus left behind. always I would say is keep the piece on the opposite side. And if you flip it over, if you have this plate which is there, you can just go ahead and separate it. And once that is done, then you have again your pieces and you can go and eat it as usually. The key is if you want to do a fast surgery, you can ramp it up and there, it's all eaten up as fast as possible. As I said, you can do the bimanual or continuous. Here it was a hyper rope. Now the thing about the white star is hyperpulse mode. Now if you keep it continuously, basically what happens is the period of rest is lessened. While if you have it as variable white star, only when there's maximum occlusion, it will come. So we put the cortex on? Yeah. So here I'm using my bimanual irrigation aspiration.
So, this is from which company, the irrigation aspiration, because it went through the side ports that you had created.
Yes, these are Epsilon. These are from Epsilon.
These are from Epsilon. Okay.
Yeah, these are from Epsilon. So they go into your 1.5 or 1 mm also.
Yeah.
So as you see, it's pretty clear. You just have these few cells which are there. So you can do this eye with the eye or do with the hydro polish. So I'm just here taking the irrigation probe just through the main port. You don't want to compress the chamber, just shallow it nicely. And then you get a nice clean posterior capsule. So implanting the lens becomes easier.
So I think I saw one thing which is common to everybody was that everybody is hydro polishing now.
Yeah, so hydro polish basically just leaves a much cleaner capsule for implantation of the lens, lesser PCO rates, and it's very easy. Light nodi.
Yeah. And this is again
The synergy lens. I'm doing a little bit of a wound assisted, and here you can see you want the main haptic to go inside, the leading haptic.
Yeah.
Regarding the trailing haptic, it's very easy. You just need to just dip it in. This lens is lightly yellow tinged, not like completely tinged like the panoptics. So therefore the patients don't have that change in color. So if you have a proper chromophobic lens, which is the blue blocking lens, they always have a color difference. While this being very lightly tinged, you just have no proper light blocking effect, but just the wavelength which you need. And that is why the violet is not that much blocked, and that really helps in the contrast, because you do need violet light, not completely blocked, the blue light, just partially. And you can see there's a little small amount of cortex just in the corner over here. I'm just going to go and take that out. Yeah, that's it.
Okay, that was very nice.
And as you can see, you got the lens well centered, very good overlap. It's opened up nicely. There. So we can do light canasteria. As you can see the rotation is really, yeah, you can see the centration is perfect, very well centered, exactly to light canasteria ji. Aitu operation aitu chanagire. So as you can see, for a hyper rope, it really makes a lot of difference. Plus 26 diopters, giving all range of vision and very good clarity. So that's about it. Yeah.
Thank you so much, Savio, again for such a effortless surgery without any this thing at all. It was really very well done. So we've seen a couple of cases which are we've seen all varieties of cases. Now I'm sure we are going to see some more myopia, hyperopia, and very nicely. And the best part is that the transmission is very good.
So once again, thank you very